Hi, my name is Dr. Sharmin. I'm a Bengali speaking psychologist who's able to translate her therapeutic interventions into Bengali. I specialize in working with trauma, and a lot of my clients from the Bangladeshi background refer to me when they need a therapy for PTSD. In my clinical work, I've worked with a lot of clients who have experienced road traffic accidents and need support in order to process these memories and traumas and to increase their emotional well-being. Some of my clients are unable to leave the house and experience a lot of negative thoughts and emotions associated with their traumas. They might also isolate themselves, keep to themselves from social activities, and therefore increase their social isolation. The overarching fear for this client group is that the accident may happen again, and therefore this keeps them from moving on with their life. As a psychologist, the treatment modality I use for this specific client group is cognitive therapy for PTSD. This is an evidence-based intervention to support clients to process their memories, to overcome their negative thoughts and emotions, and also be able to regain their sense of control and also be able to regain their sense of independence. This type of therapy can be offered online or face-to-face. The very first step of cognitive therapy for PTSD would include an initial assessment where I would assess the client, including finding out about their history, their background, the nature of the road traffic accident, their thoughts and emotions, and also the behaviors that they're engaging in that's preventing them from leading a meaningful life. The assessment will also focus on the impact of the trauma and include psychometrics so that we can gain an objective idea of where they're at in terms of their psychological health. Once the assessment is complete, I would then go away and collate all the information together and write up a report, including a treatment plan. In the therapy sessions, the very first step is psychoeducation, where I explain to the client what PTSD is, how it can occur, the impact it can have, and also talk about the impact that it is having on their lives. I take a really kind and compassionate stance in this because I know how difficult it can be for this client group to come into therapy, let alone to face the memories related to the road traffic accident. So a compassionate and non-judgmental stance is what's needed. One of the most common challenges experienced in working with this client group, so Bangladeshi clients who have experienced a road traffic accident, is the stigma and the taboo of associated with coming to therapy. This can be seen as a cultural consideration to take into account not only during the assessment but also during the therapy sessions, and also discussed and addressed with the client in therapy. Multidisciplinary team meeting is required for this client group because they require care from different aspects or different professionals, and it's really important to have these regular MDT meetings to share progress and discuss treatment plans.